Hi, everyone. This is Meredith Whitmire, and I think we're going to go ahead and get started since it is 2 o'clock on the East Coast. So, thank you so much for joining Defeat Malnutrition today for our, I believe this is our third webinar on state and local advocacy. And we are delighted to have with us today some folks from newer areas that are working on this. As I'll talk about, we have some states have been pioneers in this, but we're really excited to hear from folks who are working in different states. So I'm going to get started. We are assuming there we go. Slides are moving forward. So Defeat Malnutrition today, in case you're unfamiliar, which I'm assuming all of you are probably familiar, but it is a coalition of over 90 national, state, and local stakeholder organizations, including community organizations, aging, nutrition, advocacy, all kinds of different groups. And we share the common goal of achieving the recognition of malnutrition as an indicator and vital sign of older adult health risk. And we are trying to create policy change toward a greater emphasis on detecting and preventing malnutrition. So we've curated a number of resources and infographics on this topic on our website and elsewhere, including our national blueprint. We have a state legislative toolkit that I will be talking about later. We have infographics to summarize the blueprint and the toolkit and on Malnutrition 101. We have articles detailing the issue of malnutrition, studies, and links to other resource hubs and publications. So as I'm sure all of you on this webinar are aware, malnutrition is a huge and costly problem. This map really, I think, gives a great highlight of that, given that, it's still in the millions of dollars for disease-associated malnutrition for even on the lower end of states. So, just wanted to give you a quick overview of what's happening now, generally speaking, in the U.S. A couple of years ago, the National Conference of State Legislatures passed a resolution supporting malnutrition prevention and awareness in their official platform, and that has remained in their platform. So partially as a result, key states are taking action. We've heard about Massachusetts and Ohio and Virginia before. Connecticut is gearing up. As you'll hear, New Mexico is gearing up. In Maine, they just introduced a bill to work to eliminate senior hunger and hunger generally, and malnutrition and food insecurity. So they are really combating the issue on all fronts. And the legislation would work to create a state plan to combat these challenging issues. We have interest building on a more grassroots level in some other states, including Florida, where they've put together a public-private partnership to study and to work on the issue of malnutrition. We have Washington. We have folks in Pennsylvania, as you'll hear from later. There's been motion in Texas, and there are potentially other states that are out there working on the issue as well. So some more examples of statewide activity. In Massachusetts, a Malnutrition Prevention Commission was formed through legislation, and it has completed its first year report, and that's available on our website. And a couple of weeks ago, they had a Malnutrition Prevention Week statewide with more than 75 participating sites and programs that perform screening for malnutrition and have provided some great information, tools, and infographics on malnutrition as well, so for the education purposes. In Ohio, an MPC was also formed. It was of a one-year duration. The MPC in Massachusetts is ongoing. and the Ohio one has completed its final report. And in Virginia, the pre-existing Commonwealth Council on Aging has integrated malnutrition prevention into its duties. So they are supposed to be studying and addressing the issue of malnutrition. And as I said, you will learn about activities in New Mexico and Pennsylvania in a moment. So I realized that I neglected to go through the housekeeping, and just wanted to let you know, since it's a pretty small group today, we'll still be holding questions until the end, but I feel free to submit questions because we will probably have a chance to get to yours. But we will again be addressing those at the end of the presentations. All right, so I wanted to do a brief poll. How many of you currently are taking state and or local action? And I'm going to launch this poll now. All right, I am closing the poll. And interestingly enough, we had, just under half of you, it looks like it's close to a 50-50 split of folks who are taking action versus not. And we're hoping by the end of this, you'll be inspired to take action in your state if you're currently among the half of folks who are not taking action. So, wanted to go ahead and get started with our great presenters today. We have first Stephanie Rogas, who is the Public Policy Coordinator for the New Mexico Academy of Nutrition and Dietetics chapter. And let me go ahead and, Stephanie, turn over the control of the mouse to you. Just a second. All right, Stephanie, you should be good to go.
Okay, thanks so much. Hi, everyone. I'm Stephanie Rogas. So I'm, like Meredith said, the Public Policy Coordinator for the New Mexico affiliate of the Academy of Nutrition and Dietetics. So I was asked to talk a little bit today about how we introduce the process of introducing legislation around malnutrition in the state and kind of, what happened with that. So let's see. How do I advance?
You should click on help.
If you want, you could also just advance. I don't see.
Okay. Or if you click on the blank, the area that is not the GoToWebinar panel, it should pick it up.
Okay. Oh, okay. All right. Good. So let's see how this goes. So before I begin talking about what we did with malnutrition legislation in the state, I want to talk a little bit about the state of malnutrition in the state of New Mexico. So malnutrition simply means poor nutrition, and so it can be related to an excessive or an imbalanced diet, and can look like a few things. It can look like hunger, so not getting enough to eat, or it can look like obesity or overweight, so eating too few nutrient-dense foods, causing deficiencies in micronutrients. And so poverty, it's a major contributing factor to malnutrition. And New Mexico is a relatively poor state. There are a lot of people in our state receiving income and food assistance. Food insecurity among children is higher in the state than it is in the U.S., with 1 out of every 4 children experiencing food insecurity in the state. We also have a large and growing older adult population. And the fact that the state is fairly rural makes issues of food access significant issues in the state. And malnutrition in the state, as well as, across the country, is very costly. So New Mexico spends more than 28 million, so about just under 30 million on malnutrition related costs, and actually ranks fourth out of the fifth highest spending states on malnutrition in the country. So issues around malnutrition are really important for this state in particular, and it's part of the reason that we wanted to tackle this issue, and it's part of the reason that the Academy of Nutrition and Dietetics is very interested in tackling this issue and has made it a focus in the recent past. So how did we get started with this legislation? So I'm the public policy coordinator for our affiliate, and as the coordinator, I am charged with setting up meetings with Congress, our members of Congress and our staffers in DC every year around major policy issues that the Academy is interested in pushing and moving forward. And this past fall, I went for the 2018 Public Policy Workshop, and the focus was on malnutrition. And so I talked to staffers because we were just before the midterm election, so nobody was really there, but we had a lot of great discussions around malnutrition and what the Academy is doing in collaboration with Abbott and other organizations around malnutrition. And so I then came back to New Mexico and had a conversation with another advocate who works closely with the Academy about doing something at the state level and about state level advocacy around malnutrition. So in 2016, New Mexico passed a memorial that basically made it, a malnutrition awareness week in September of that year, and so that was a great start to introducing and raising awareness around malnutrition in the state. But I talked to my colleague about potentially pushing something through the legislative session this year that had a bit more teeth. And it just so happened that at the same time, Sherry Coffey, who I've been working closely with for a while, along with, and she brought in Allison Griffin, who, I can't sing their praises enough because they've done so much in this effort. But she reached out to me. She's Abbott's regional director of state government affairs. And so she reached out about introducing a bill into the New Mexico legislature around establishing a malnutrition commission in the state to basically study the state of malnutrition. So just to give you a sense of the timeline that we were working with, the New Mexico's 54th legislature, this session started January 15th of this year. So the pre-filing session was basically from mid-December to mid-January. February 14th was a deadline for bill introduction, and it was a 60-day session. So March 16th was when the session ended. And so we had started these conversations early in December. Luckily, Sherry has been, really great in working with other states to get malnutrition legislation passed. So she already had, some good experience that she could pull from, and already had, a draft bill that we could kind of tweak and look at and then shop around in hopes of getting a sponsor. So our hope was to get a sponsor, before the session began, so that, we could really push this legislation through and get it passed in this legislative session. So I live in Las Cruces, and therefore I'm not in Santa Fe that often. Las Cruces is about a 4-hour drive from Santa Fe. So luckily, I was already planning to go to Legislative Day at the Capitol, where the New Mexico affiliate of the Dietetic Association hosts students, and in order to teach them a little bit about advocacy at the state level, and also to facilitate some meetings with our state legislators. So that was a nice time for Sherry, Allison, the public policy panel of the New Mexico affiliate, to kind of meet up in person and to see what we could do to kind of push this legislation forward. So this is a picture of that. Once we met that day, Sherry had been doing all of this footwork in trying to get a sponsor. So Representative Debbie Armstrong had sponsored the previous memorial, and we'd reached out to her to maybe, gauge her interest in sponsoring this bill. She said she had too much on her plate, and so we were kind of going around and scrambling to try to find someone to sponsor the bill, and Sherry did a lot of work on that. trying to get this done before we all met on legislative day. So we get there on legislative day, and Sherry's kind of looking frazzled and exhausted, and we didn't have a sponsor yet. So we started the day's sessions. We were working with students and talking about advocacy, but also trying to meet with other stakeholders and trying to meet with other legislators in hopes of getting a sponsor. So luckily, my colleague on the public policy panel was able to meet with her representative she brought up another issue that she was interested in, and then she also brought up this bill. And this Representative Karen Bash, just so happened to sign on as a sponsor right then. She said she was already drafting the legislation as they spoke about it. So that was very exciting because that's something that doesn't happen very often, and it moved very quickly from there. So that was really cool. And so something I want to point out on the top left-hand picture is the guy speaking is Gino Rinaldi, and he is of the Senior Services Division in Santa Fe. So something I wanted to note here is that the bill to establish a malnutrition commission to study malnutrition in the state started out with a focus on senior citizens, with a focus on older adults. And, he's obviously one of the advocates for older adults and was very much in support of this bill in its original form. Then Karen Bash started, working on the bill and wanted to expand and broaden the scope to include children as well. So it kind of illustrates some of the issues that we had to deal with, in some of the compromises we have to make when we're dealing with legislators that might want to include other things, but then also your advocates that are, really focused on certain issues. And so we had a lot of conversations that day, and then had Gino actually come up and talk to the students about some of the issues we were talking about. And one of those in particular was that Gino was worried that the emphasis would kind of shift away from older adults if we included children in the bill. And so that was kind of really interesting to see play out, and I think is a really important lesson in trying to get these things passed. So we ended up with a bill. We had a sponsor. A couple of days later, it was, it got its number and it was formalized. We had House Bill 466, which would establish a malnutrition commission, basically charging the governor with putting together a group of individuals to study the state of malnutrition in the state. So initial sponsor was Representative Karen Bash, and then you can see down below the other co-sponsors, which included Deborah Armstrong, but all of these co-sponsors were all committee members of the House Health and Human Services Committee, which is also important to note. So the bill would have brought together individuals, so stakeholders that with expertise in malnutrition from various places. So from various agencies in the state, such as the Department of Health, Agriculture, Human Services, Aging, Public Education, Indian Affairs, of course, the New Mexico Academy of Nutrition and Dietetics, because dietitians are so integral and important when we're thinking about malnutrition, issues around malnutrition. It would have brought together researchers, health practitioners, and professionals. And so it really would have brought together this really great and diverse group of stakeholders to really study this issue on malnutrition across the state. And something else to note is that we had immense support from other individuals, so other stakeholders and other groups that were really working on anti-hunger policy and advocacy. So this is something we didn't start out with. It wasn't until after we got the sponsor, we got Representative Bash to sign on, that we really started to reach out and to form a coalition with other supporters of this, the other potential supporters of this bill. So, of course, New Mexico Academy of Nutrition and Dietetics signed on, Meals on Wheels, AARP, Alzheimer's Association, Roadrunner Food Bank, and other, anti-hunger organizations kind of quickly signed on. And we did a lot of footwork again, and that was definitely more so Allison Griffin in really getting these individuals on board and to support the bill, which is really, really helpful in moving it forward. So then it was put on the schedule to be heard in the House Health and Human Services Committee. It passed that committee. It passed the State Government Elections and Indian Affairs Committee, and then unanimously passed in the House, which was really exciting and energizing for us. And it got, everyone, all of our stakeholders in the coalition really excited about pushing this forward and moving it through the Senate as well. And so once that happened, we really pushed, we called, we wrote letters on behalf of the coalition to senators in order to get them, to get that support from them and to get their buy-in in order to pass the bill in the Senate. And so kind of in the middle of this, we had the End Hunger Day at the Capitol. And so a lot of anti-hunger groups were then there. And a lot of the groups that signed on in support of the bill were also there, and were there in support of the bill, in addition to their other agenda. But this was really key in sort of starting to get them that momentum in order to get the Senate buy-in from specific senators. And so you can see there on the very right is Allison Griffin. I'll just point that out. Unfortunately, I was so busy with my job during this time. Her and Sherry were both so great at being able to kind of be there in person and really connect with our coalition and the legislators in person. And so we left a few leave behind. So we left a short leave behind about the bill, in addition to fresh fruit. So this is just an example to show you kind of what that looked like in order to again raise that awareness and garner support for the bill. So then the final step here was to get it through the Senate. So it passed the Senate Public Affairs Committee and then ended up going to the full Senate for a vote because it was nearing the end of the session and we were all biting our nails and it was extremely anxious period of time. So unfortunately, it went to the full Senate for a vote and failed to pass in the Senate. So it failed by about eight votes. So that was a little bit disheartening, but we learned a lot. We gained a lot of momentum in the process. We have a few, lessons learned and next steps. We're obviously moving forward. I think one thing that was really beneficial in helping to get this legislation moved through the legislature as quickly as it did and to garner so much support in the House was the fact that there was so much support within the House Health and Human Services Committee for this bill. And I also think that, we have a lot of stakeholders and individuals working within the state on anti-hunger advocacy and policy and really building that coalition and bringing them together in support of, a single piece of legislation helped move that forward, I think, a lot more quickly and a lot more successfully than maybe it would have otherwise. And then we're obviously moving forward with this. So there's a loose plan in place to meet with for our organization to meet with the governor about how to move forward, but we're also still in touch with those advocates that we've been in touch with, those stakeholders that we've been in touch with throughout across the state, really to come together with them and then with our legislative leaders in order to develop the next steps to hopefully to establish the Malnutrition Commission, whether that be through regulatory measures or legislative measures. We don't know yet, but we're really excited about the possibilities here. And that's all I have.
Great. Thank you so much. That was very interesting and enlightening. And I don't know about everyone else, but I really appreciate hearing a story where, you're taking lessons learned and you're really applying them to, what comes ahead. I mean, with a lot of these efforts, it's not necessarily successful the first time. So just really excited that continuing.
Yeah, exactly. So, I feel the same way.
Next speaker, sorry. So our next speaker is Naja Orr, who is the Chief Strategy Officer for the Philadelphia Corporation for Aging. And Naja, let me give you mouse control. All right, so you should be able to click on the screen and then click again and it should be okay.
Excellent. Thank you, Meredith. Once again, my name is Naja Orr. I'm the Chief Strategy Officer for the Philadelphia Corporation for Aging. We are the designated area agency on aging for Philadelphia County. So that puts us right in the southeast corner of the state of Pennsylvania. Oh, jumped a little too quick there. Bear with me 1 second. So once we heard about defeat malnutrition back in 2017, this is something that we knew we not only wanted to support, but we really wanted to be a part of this campaign. We instantly knew that this would help us in our efforts to bring awareness about malnutrition and hunger and food insecurity in general with older adults. But it would also give us an opportunity to get together with our collaborative partners and really do a better job of connecting people to resources than we do now. We currently, as the Area Agency on Aging here, we do focus on food insecurity with older adults through our congregate meal and home delivered meals program. And I'll go into that a little bit and in a few other programs that we have a little bit later. But we knew that bringing our collaborative partners together to strengthen this in this area would be something that would be very positive for us. Currently, through our congregate and home delivered meals program, we generally serve about a little over 2 million meals each year. The scope of our AAA here, we typically serve for all service programs a little over 140,000 consumers annually across all service programs, but hunger is obviously one of our main focuses. Once we heard about the numbers when it deals with malnutrition and hunger, of course they're staggering to us. Philadelphia is a high area that has a lot of poverty. So with the number of older adults that we have, just under 300,000 older adults in Philadelphia County, we knew that the statistics tell us that 1 in 2 older adults are at risk for malnutrition. And those numbers are even higher for those individuals that are entering the healthcare setting, whether they're in a hospital, nursing facility, or a personal care facility. We know that those numbers are even more staggering when it comes to healthcare costs. We know that statistically, anybody who has entered the hospital has a 300% greater chance of being malnourished, and it could increase their hospital days anywhere from 4 to 6 days. We knew that joining this campaign, it would also give us an opportunity to have some sub-goals that we could work on. In addition to tackling food insecurity, malnutrition, and hunger, we could also do a better job of tackling those individuals that are at risk for isolation as well. So really, we took a several-pronged approach, a year 1 and year 2 focus. Year 1 really was to primarily focus on our internal campaign. What could we do to strengthen this campaign and garner support throughout our organization? So we created internal committees that would be represented by every department in the organization. So that way they would have that personal touch, that liaison that would connect them from their department to our campaign. And then next we developed the mission statement. So that way the work that we wanted to proceed with, we would ink that on paper to keep us focused. Next, to raise staff awareness, we started disseminating more information to the whole organization. Our INET, as you see there, is our internal intranet that we communicate information to staff on a regular basis. So we started sharing information about the campaign, about malnutrition on INET. We also have an electronic bulletin board on our first floor and our 5th floor that it shares information with visitors as well as with staff. So staff that are coming in will get a regular message of the day that rotates on the screen, and we started sharing more information about the campaign. As well as articles. We started sending staff articles to really, so they could have a greater understanding of the footprint that we're trying to put forth. And we started putting more information on our agency website. So next we decided we really wanted to bring together some of our collaborative partners and have a day-long event that would educate our staff, really give them more information about the impact of malnutrition in our area. to really focus and learn from some of our collaborative partners. So we brought in 4 of our partners: Phil Abundance, Share Food Program, the Coalition Against Hunger, and Aid for Friends, to really help us talk through what are some best practices, what are some things that you've seen that have worked really well for you in the fight against malnutrition, what are some things that we could do better, and collaboratively, what can we do if we work together more closely to combat this issue in our area. Next, we wanted to highlight some things that we're currently doing. So we brought attention to some things that are happening at some of our local senior centers. They're already working with a local farmers market to bring fresh fruits and vegetables to older adults in the area. We distribute produce vouchers through the grant that we received from the Department of Agriculture to make sure that older adults, through our partnership with our senior centers, are connected to fresh fruits and vegetables. And then also, just to make sure people understand that through the senior centers, there's an opportunity to participate in food and nutrition demonstration as well as education classes. And then before MLK Day of Service, about 2 weeks prior, we decided to have a food drive where that 2 weeks prior, we were able to collect 20 boxes that was the equivalent of 500 pounds of food that we donated to our collaborative partner that I mentioned previously, Phil Abundance, so they could specifically make sure that that got in the hands of older adults throughout Philadelphia County. And then now that brings us to year 2, where this is where we knew that the rubber would really meet the road for us, because then we wanted to take the campaign that we started internally about a year ago and really bring in more of our collaborative partners. What can we do to strengthen our relationships with our collaborative partners so we can collectively work on this issue together and bring this campaign to our region? So we set a date, which was just about 2 months ago now, where we invited just under 130 organizations to really make sure that they understood the importance of this campaign and how we can build this campaign together in our region to make sure that we're doing a better job of combating this issue. So here's the flyer from our event, which was March 19th. We had an opportunity to have approximately 74 or so of the agencies, of the 124 agencies that we invited, showed up to the event. And you'll see a host of different types of networks that the organizations come from government to hospitals to law offices that we work with, mental health facilities, as well as other collaborative partners, representatives from the council, from Pew Foundation, health and wellness programs in the area. So as I mentioned, we had just about 75 or so, a little over 75 that attended from those various organizations. And to help us with the kickoff of our larger campaign, Bob Lancato had an opportunity to join us as the national coordinator for this campaign. We were just pleased that Bob was able to come up from DC to join us for this, to talk about some of the goals and strategies that the national campaign has been working on, talk about a few of the best practices, things that they've seen down in DC, and collaborating with the 90 plus organizations that have joined this organization and really help us with our footprint here in the Philadelphia area. So we've started off right. So after Bob gave the keynote speech, we had an opportunity to break the attendees into 3 different committees. The first was advocacy and awareness. The second was community education and resources. And the third was healthcare. And we had each of the participants of that event self-identify which group you felt most comfortable to join, and then any goals and work that we would be proceeding on over the next 6 months or so, you would be a part of that committee. We also asked that each of the committees, as they were coming together, not only talk about goals and strategies, but also to identify 2 individuals that would co-chair each of the committees, so we can make sure that we touch base with the co-chairs on a regular basis as they work through their projects. So the first committee, advocacy and awareness, we really wanted to look at the national campaign and identify different pieces of legislation or different advocacy campaigns that are not only going on nationally, but also what are going on locally here that we wanted to be a part of, that we wanted to raise awareness about, that we wanted to make sure that if it's a call to local legislators related to a malnutrition or a hunger bill, that we would have the garnered support with this committee, as well as the rest of the campaign here, to really raise awareness. The second committee, community resources and education. We really wanted to do a better job than we do now, like I said, of collectively coming together to make sure that we are working more closely to really connect individuals to resources, making sure that a lot of us have common goals. We want to tackle food insecurity and hunger and malnutrition in our area, but working collectively, how could we do a better job of making sure that as individuals contact us, that we get them to the appropriate agency that could meet their needs. And then the third is healthcare. As we work closely with our hospitals and our institutions of higher learning, what could we do to make sure that we're looking at the appropriate assessment tools? And do our hospitals have the appropriate tools to assess for hunger and malnutrition? And not only that, but as they assess for malnutrition and hunger, do they have resources at their fingertips to make sure that they're referring people to the appropriate agency that could support that individual before they were discharged from the hospital, make that connection. So the first event we felt was successful, having about 65% or so of those that we had invited attend the first event. We also started receiving contact from other individuals who were unable to make that first day, saying that they were very interested in being a part of this campaign, that this was something that was near and dear to their heart as well. So our numbers have been growing since that first event just about 2 months ago. And as I mentioned, year 2 for us, this is really where the rubber will meet the road for us. Each of the committees now for the last 2 months have been working on goals, strategies, and projects. And we do have a liaison here at the Philadelphia Corporation for Aging that's been keeping in touch with each of the committees just to make sure that they stay focused and they continue down their path of working on their projects. We plan to come back together as a full group in October to talk about what are some of the things that the committees have worked on, and what are some things we can do collectively when we come back together. Also, we want to make sure that we're defining success. What outcomes do we want to start measuring as a group? What are some things that we want to look at as far as best practices? And how can we document this process to make sure that we're capturing it accurately? And best practices, what are some things that work well for us? What are some things that may have been some stumbling blocks for us? And then, very importantly, how could we show that this model can be replicated in other areas? As we start communicating with some of our colleagues at the other area agencies on aging in the state of Pennsylvania, we want to bring awareness to our campaign to them and show them that this is a model that can easily be replicated. It's been so far successful for us. We've been very pleased ever since we joined the Defeat Malnutrition Today campaign, and I think that over the next few months we're just going to see more good work from the committees, and hopefully we'll be able to continue down the path that we've been so far. So we're really eager and excited to continue down this path, and it's been just a tremendous experience for us so far, working with Bob and Meredith and the crew, and as well as the other collaborative partners part of this campaign. So that's my piece. Thank you.
All right, thank you so much. That was great, and I also wanted to congratulate you guys on the press coverage you had gotten from the Philadelphia Inquirer.
Oh, thank you. It was fun. We had an opportunity to connect with several folks from the committee that were there to give some points that the press was very interested in. I think we're going to see some follow-up articles as a result of that as well. So thank you.
You're welcome. It was great. It was a good article. Bob was interviewed for it as well, and it turned out he and the reporter had, like some background in common, and it was a very Bob, if you guys know him, interview.
Oh, we do. I love it. I thought it was a good article. It was very well written, and I'm glad it helped us bring a larger spotlight to this campaign. Thank you.
Sure, thank you. So just wanted to talk about some of the resources we have really quick before we get into some questions. Defeat Malnutrition Today has the State Legislative Toolkit, which is a guide that is specifically for state legislators and their staff. And I specify U.S. because we do have some international cohort, that's interested in this. So this is more geared toward U.S. state legislators, but I'm sure it could be modified depending on your system. And it includes sample resolutions, commission legislation, some sample op-eds, sample social media, et cetera, et cetera. And it includes a summary of the issue and its cost to states. So it's something, it's a nice 101, and here's what you can do about it kind of thing. So in conclusion, and of course looking ahead, we think that folks need to keep raising awareness, all of us, about malnutrition as a threat and as a deterrent to active aging. We need to implement solutions not just at the local and state level, also at the national level. And we need all of you to use your influence at home to help us get more state and federal legislation. I mean, it's great for those of us, in DC to do work, but at the same time, legislators definitely appreciate very much more hearing from their own constituents. So in short, help us to defeat malnutrition today. Please check out our resources and join the coalition. And here are said resources. And these slides, by the way, are available for download if you click on the handout section. And if you can't download them, just email me, and I will be able to send those to you. And here is our contact information. So we have a question. It is, how did you deal with HIPAA when developing hospital gatekeepers who would share information about seniors being discharged? And I'm not sure who that
I could jump in there. That's actually, since we started working with the hospital groups with our healthcare committee, that's something that we started discussing. One of the things is to make sure that we're compliant with HIPAA. I know that hospital discharge social workers oftentimes will make the referral to us anyway as the area agency on aging if they're looking to connect people to resources. We will typically be one of those organizations that will receive the referral. Of course, one of the important things is just to make sure that the appropriate release forms are signed so information can be shared. And one of the things that I know that the group is working on is talking about.
Andrew.
Is that him?
Oh, Bill.
You guys are on the wrong line. Okay, I'm so sorry. Continue.
Oh, no problem. So I know that's something that the group is working on, that healthcare committee, as they talk about just making sure that we have appropriate things in place as far as resources that the hospitals can be referred to, as well as making sure that consumers do sign off on making referrals to the appropriate organization. So, what we should have more related to that topic as we come together again in October.
Great, thank you. Does anyone else have any questions? We would love to hear them. And if not, we can always sign off, but I will give you guys a moment to, think of any more questions. All right, well, in the meantime, I have a final poll, and this one is for everybody. Are you interested in taking state/local action, especially now that you've had this webinar experience? And if no, we understand. People are busy, but I'm loving the responses I'm seeing so far. All right, so this is great. 92% of folks are interested in taking action. So depending on where you are, you can email one of us to, describe what you're interested in and how you want to approach it. Do you know state legislators, that kind of thing? Or are you interested in starting a local coalition? There are a lot of options here, as you've heard. So I don't think we have any more questions. So I'm going to end a little early, give you back some time. Thank you so much for attending, and please, especially if you answered yes on this last poll, fill out the survey that pops up. Thank you all so much.
Thank you, Meredith.
Thank you.